Time now for News Talk. Dr. Timothy Pfister joins us now live in studio to answer your questions. 793 WKTV about your dental health. And before we get to calls, I want to talk a little bit about a topic that we were discussing during the break, and that is diet with regards to your dental health. I mean, some of the stuff is pretty simple and you know, less sugar, you'll have less decay, but we're talking about really starting really early when it comes to kids, because it has ramifications throughout the rest of your life when it comes to dental health.
Absolutely, Jason, and that's one of the things, it just, you know, it builds on the mom and dads out there need to realize that they need to take that kind of extra effort with their children to make sure that they get these, you know, the diets that are more holistic and have lots of more fruits and vegetables and whatnot. One of the labels that they can really read when they go to the grocery store is this corn fructose, or anything with an O-S-E on it, OS. That means it has or contains sugar in it. The refined sugars are much more less well for, it causes inflammation basically, and the kids can't develop as well.
I want to put a picture up real quick that you sent in to us. The differences for those that have better diet. Tell me about it.
Yes. This picture is a picture of two brothers who are from the Isle of Harris, and the one on the left, you can see the difference in the teeth. The one on the left has rampant decay. He had gone, and at an earlier age had moved to the city and had much less less garden-fed food, not so many fruits and vegetables, but more of the refined sugars, and you can see his facial features also are less well developed. His jaw is not as well developed, and his overall facial features are not as good.
All right, we do have a call, so let's get right to it. Go right ahead. What's your question for Doc this noon?
Hello,
yes, go ahead.
My name is Chris. I was just wondering, I've noticed a little bit of tooth decay in my son, and I was wondering if there's anything I could do to help prevent this. He has a pretty regular diet, fruits and vegetables. We give milk, juice, kind of dilute the juice with water. Is there anything I can help with his tooth decay?
How old is he?
Right.
2.5.
2.5.
That's plenty of time to go start seeing a dentist,
Absolutely.
right?
That's about the age you may want to bring him in with mom or dad. He can sit in the chair with, you know, while they're having their cleaning and so forth, and gets a really better idea about how things progress at the dental office. It can really introduce him slowly that way. And he can have some fluoride supplements. We can give him some supplement for that, or he can use a mouth rinse. And if dad and mom go over with him how to brush and so forth like that, and the hygienist, the child can see how the hygienist interacts with mom and dad, and they themselves can, you know, get a better idea.
I heard him mention juice as well. That's one of the worst things for teeth is, and I know he said he diluted it a little bit, but
does he put it in a bottle at night for the child? Does he still have a bottle? No, probably not at this point.
No, I think the caller's gone, but he's probably watching. So
right.
Yeah, start to eliminate the juice anyway.
That's right. That's exactly
for your dental health.
Yeah, and some of those juices do have a large content of the fructose in it.
We've got time for one more quick call. Go right ahead. What's your question this noon?
Yes, if you wear dentures, how often should you go to your dentist?
Well, that varies. It depends on how old they are. You do want to make regular visits because you still want to be checked for cancer screening and those sort of things with your soft tissues. How old are your dentures?
I'm guessing they're probably 7 or 8 years old.
I would definitely get in and get to the dentist and at least see because the whole the denture itself can wear quite a bit, and you want to get a good fit. You want if the dentures aren't fitting well, you're not chewing well, and also it's more destructive for the underlying bone. So yeah, you want to get in fairly regularly to still see your dentist. Even though you may have dentures, you still should go in.
All right, thanks for that call, and thank you, Doc. Good to see you as always.
Okay, Jason.
We'll see you next month.